Sure. I just got up one morning and I experienced numbness down my left leg, had discomfort in my back and hips, and then within days had tingling over my foot and bottom of my foot, and experienced some weakness in my left leg. Well, my primary care doctor is at UVA, and I went to her, and she did an examination and then referred me to radiology to have an MRI. Yes, my PCP recommended that I see somebody at the Spine Center, and an appointment was made, and I came to see Dr. Scheimer, who was highly recommended. Yes, they did a very good job of that. They pulled up my MRI and went over the results of that. They discussed conservative treatment versus surgery, and conservative treatment options were to have an injection into my spine, and I did that. That was scheduled and done within a week, and several weeks after that I came back to clinic, and I didn't have any results from the injection, so I came back to UVA, back to the clinic for another consultation. We discussed my active life as far as how much I do as far as gardening and walking and my physical activity. I'm very active. And because of that, by that time I had started to experience quite a bit of weakness in my left leg, and it was felt like some intervention pretty soon was the best thing for me, which was going to be surgery. And Dr. Scheimer looked at my MRI and talked to me about my situation and said, "I think I can help you." And that's where we proceeded to discuss surgery. I did. I felt like he was very honest about the surgery and the recovery, and we went over, he was very thorough in his explanation about what to expect. When we talked about surgery, the option of surgery was explained that it would be on an outpatient basis and that I would not be admitted to the hospital. And initially that sounded like a very good option. And we proceeded then to post the operation date. Well, my relationship with the team has been positive from the first referral. I felt like I was listened to, patient. I think that my concerns were addressed. I made several phone calls back and forth to the office before I actually had the surgery, and they were very patient with me when I was exploring my options. But the team, from the receptionist to the nurses, the patient care assistants, were all very kind and thorough in their care. And then when surgery was scheduled, I felt very positive about the team's approach to my operation. My initial recovery was remarkable in that the weakness had completely gone away. I had no tingling in my legs, and the strength returned within weeks. I was able to start walking again, and within the first 3 weeks was walking between 2 and 3 miles a day. Now I am 3 months post-op, and I am walking 3 to 5 miles a day. I'm able to do most of the activities that I was doing prior to my surgery. I would definitely recommend the UVA Spine Center to anyone with a similar problem or concerns. I feel like they are very thorough in their assessment, and they give you every opportunity to be a part of the decision making, and they're a very good team. One of the most positive interactions I had with the team was with Dr. Scheimer, in that he took time to listen to me. He sat down, he heard my concerns, and we discussed options of my care. He was very involved with my decision, And I feel like that was the most valuable aspect of the encounter, was the time that people spent with me.
Well, the UVA Spine Center takes care of a diverse array of spinal problems. We take care of everything from the neck or the cervical spine down to the low back or the lumbar spine and everything in between. We take care of degenerative problems. Those are problems associated with arthritis. We also take care of complex problems like deformity or infections of the spine, tumors of the spine. I really think we provide the full complement of care for all spinal problems. So one of the unique aspects of the UVA Spine Center in its design was really a comprehensive care of both operative and non-operative techniques for problems associated with the spine. So we have a full complement of practitioners that include multiple different departments, including orthopedics, neurosurgery, physical medicine rehabilitation, and pain management, who is through the anesthesia department, as well as physician's assistants and nurse practitioners. And they allow very basic care of simple spinal problems up to very complex spinal problems that requires some sort of surgical intervention. Yeah. So I think the University of Virginia Spine Center provides innovative care not only by delivering the latest technology, and those can be technologies that allow us to accomplish surgical goals through very limited exposures that doesn't disrupt the normal muscle or tissues around the spine, but also the way we rigorously research spinal care and to try to not only use technology but knowledge to improve the care we deliver. Spinal care can be very challenging because it can present in many different ways. It can present as arm or leg pain. It could present as difficulty walking or problems with normal everyday activity like buttoning your shirt or opening a jar. Because of that complexity, I think it's very challenging to not only diagnose the problem correctly, but to also deliver the care that's appropriate for that problem. And that can range anywhere from non-operative techniques like physical therapy or medications up to necessary interventions. So I think it's really not only the diagnostic challenge of spinal care, but it's also the nuances of delivering the appropriate treatment to the patient.
Wonderful.
As surgical techniques have evolved and become more refined, it allows us to accomplish the goals of surgical care through very limited exposures and limited trauma. With that, we're able to do surgeries that may result in a quicker recovery, has less blood loss, and really is less painful post-operatively. I think those refined techniques has allowed us to do some of the spine surgery that was traditionally done with a hospital admission to be done same day. That really provides a nice advantage to the patient to not have to stay in the hospital, to be able to have their procedure done at a beautiful new facility, which is our Battle Outpatient Surgery Center, and to really get the results they are expecting through less perhaps less traumatic, less pain around the time of surgery. Sounded good, but I painted myself into a corner. I think someone should choose the University of Virginia Spine Center because it delivers comprehensive and collaborative care. We have many different specialties, including orthopedic surgery, neurosurgery, physical medicine and rehabilitation, and pain management that allows any given spinal condition to be treated with any number of techniques that will lead to a successful outcome. I also believe that the training and expertise of everyone involved in a patient's care is unmatched, not only on a local level but on a national level. We also provide cutting-edge research and technology to deliver the best spinal care and get the best outcome for a patient.
Primarily degenerative. I do see pretty much the broad spectrum of spine disorders, all the way from tumors, infections, degenerative processes, do a little bit of deformity as a result of degenerative change, although major deformity is done in our group by some other physicians. So I would say the vast majority of things I treat is degenerative spine. I treat cervical, thoracic, and lumbar disease, and occasional trauma as well. We have a very comprehensive program. Virtually anything that requires spine surgery can be handled within our group. And certainly a lot of medical management is part of that. We have rehab physicians, we have pain management physicians here at UVA that can manage a lot of that, and then the surgeons themselves do a lot of medical management of spine conditions that aren't necessarily surgical. And certainly the preoperative and postoperative medical management is included. Well, like most major medical centers, UVA has a vast array of equipment to facilitate what we want to do at the cutting edge. We have physicians that perform minimally invasive surgeries, which, while that's not always the most appropriate path, for certain conditions it has clearly been shown to shorten length of stay, make the postoperative recovery more easy on the patient. So we have minimally invasive procedures for the right conditions. We have procedures that correct major deformity. We manage tumors in concert with UVA oncologists. So we have access to a whole variety of instruments and other tools, imaging tools, as well as other specialists to help us with some of these other conditions that require subspecialty care. Well, I think the most gratifying part of it is seeing a patient after surgery and after they've recovered who's happy, who's able to return to normal activities, has had resolution of their pain or marked improvement in their pain, and oftentimes that's the most gratifying. Other things that are enjoyable is when you see a complex problem and you're able to sort it out, particularly if it hasn't been able to be dealt with elsewhere and the patients are coming in somewhat frustrated. That's also gratifying.
Appropriate.
Yeah, I think there are a number of conditions where MIS is appropriate, and also just the streamlining of care, not only the actual surgery, but the perioperative care. We've learned over the last several decades that the sooner the patient can be returned to a more normal level of activity, in general, the more rapid their recovery is going to be. And in the old days, patients would come in for surgery and stay in the hospital for a week. Now, many of the things we do, they're in the hospital for a few hours or overnight. Here at UVA, we see patients from all over the region, so some people that have to travel long distances may stay overnight, but many patients in the closer region can be managed as an outpatient, come in, have their surgery, and go home the same day, and then they get back into their normal routine. They sleep in their own bed, and oftentimes that results in a very rapid recovery for things like lumbar disc surgery or cervical disc surgery sometimes, various things like that. Those things can be rapidly expedited with minimally invasive techniques. Well, certainly a number of spine surgeons in the region. I think what stands out at UVA is the breadth and the depth. We have a large number of surgeons both in neurosurgery and in orthopedics whose primary focus is on spine care. We have a lot of experience on our group. Many surgeons have been in practice for decades and have quite a bit of personal experience. But we also have, as I've said, we have a number of facilities that most smaller places don't have. And we have support of a variety of specialists. So patients with other disease processes that might not be as easily managed in some facilities can come here and be confident that we have the specialty expertise to help manage that as we take care of their spine. I think that's important for many patients. Yeah, I came back to UVA largely because of the breadth of the program here, the great colleagues. These are people that are experts in their field, and an opportunity to work with some of the best in the world is a very attractive thing. And again, the breadth of the equipment, you're not limited by the imaging or the surgical equipment that's available, the microscopes, the other tools, all of that's available here. And we have excellent training as well. We're training residents and fellows to become the future spine experts, and that's also gratifying to be part of that.
Breadth of care and
yeah, I think one thing I'd probably want to add about UVA is not just the surgical side of it, but it's important not to forget that many spinal conditions don't require surgery. And you need not only somebody who can do the surgery that you need expertly, but you also need medical specialists who know how to manage things medically. And we also, the other thing I didn't mention is we have excellent diagnostic capabilities. Our neurology group is outstanding, particularly the neuromuscular division, which relates to spinal disease. We have surgeons, again, with experience who are able to distinguish between an operative and a non-operative case, and who tend to go for the non-operative approach initially if it's going to work. And I think that's important to know, because sometimes the decision-making is the most important part of the patient's care.